Good morning, guys. This week we are sending out the first aid and CPR training. This portion is just going to be the first aid. There will be a quiz to follow. Make sure to complete that quiz in the allotted time given, or your certification will not be renewed. After everyone has done the first aid portion, we will Chase and I will come out to each yard and do the CPR portion to get all you guys back up to date. First and foremost, before giving care and checking an injured or ill person, recognize that an emergency exists, decide to take action. Good Samaritan laws help to protect people who voluntarily give care in an emergency situation. Make sure to always obtain consent before giving care. Give care according to your level of training. Once you start giving care, do not stop until EMS personnel take over. In first aid, your decision to act could make the difference between life and death for the person who needs help. Activate the EMS system. Activating the EMS system greatly increases a person's chances of surviving a life-threatening emergency. Call 911 to activate EMS system. Life-threatening conditions include unresponsiveness, altered level of consciousness, for example, confusion, breathing problems, severe external bleeding or vomiting or passing blood, signs or symptoms of life-threatening medical conditions, example, heart attack, stroke, or any of the following, severe or critical burns, suspected or obvious injuries to the head, neck, or spine, suspected or obvious broken bones, suspected poisoning that appears to be life-threatening, and seizures. Giving care until EMS takes over. Before giving care, you must always obtain consent. Tell the person who you are, what type and level of training you have, what you think is wrong, and what you plan to do. Obtain consent from a minor's parent or guardian if present. Consent is implied if the person is either unresponsive, confused, or mentally impaired, or a minor with a life-threatening condition and the parent or guardian is not present. If a person is alert and awake and does not give consent, do not give care. Call EMS personnel if you believe the person has a life-threatening condition and needs care. Check, call, care. Before rushing to help, size up the scene. Make sure the scene is safe to enter. Ask what happened to cause the emergency. How many people are involved? What condition is the person in? Determine whether anyone else is available to help. Does the person appear ill or have any immediate identifiable injuries? Is the person moving or motionless? Does the person have signs of a life-threatening illness or injury? For example, trouble breathing or severe bleeding, etc. Based on your scene size up and initial impression, you may need to call 911, obtain equipment such as an AED and first aid kit, provide immediate care for severe life-threatening bleeding. Call first or care first. If you are alone and there is no one to send to call for help, you may need to decide whether to call first or care first. Call first situations are likely to be cardiac arrest. Care first situations include breathing emergencies and life-threatening bleeding. Call first for any person about 12 years or older who is unresponsive, a child or infant who you saw suddenly collapse, an unresponsive child or infant who is known to have heart problems. Care first situations include an unresponsive infant or child younger than 12 years who you did not see collapse, a person who is choking, a person who is experiencing a severe allergic reaction, for example, anaphylaxis, and has an epinephrine auto-injector, and a person who has life-threatening bleeding. You want to keep the risk for infection low. You can do this by using PPE, which can help lower your risk for getting or transmitting an infectious disease when giving care. Using latex-free disposable gloves and CPR breather barriers should be included in first aid kits. Keychain kits may contain gloves, breathing barriers, or both. For checking a responsive person, remember the SAMPLE acronym. S is for signs and symptoms. A is to check for allergies. M is any medications that person may be on. P, any pertinent medical history that person has. L is for last food and drink. And E for the events leading up to the incident. After interviewing the person using the SAMPLE acronym, check the person from head to toe. Tell the person what you are doing before you begin. Avoid asking the person to move if you think the person has a head, neck, or spinal injury. Avoid asking the person to move any body part where he or she is experiencing discomfort or pain. When performing a head-to-toe check, make sure to move straight down the body and then check arms. Check head and neck first, then shoulders, move to chest and abdomen, then hips, then check legs and feet, and then arms and hands. Check one part of the body at a time. When checking the person from head to toe, make sure to take note of how the person's skin looks and feels. If there's any bleeding, any cuts, burns, bruising, swelling, or deformities, any medical identification tags, and the ability to move the body part without pain, discomfort, or dizziness. So again, when you see a responsive person who needs care and gives you consent, make sure to run through the SAMPLE acronym with them, interview them on signs and symptoms that they're having, allergies they may have, medications they're on, pertinent medical history that they have, what they last ate or drank, and when they did that, and the events that led to this emergency. And then after you've gone through that with the person, do their head-to-toe check. Head and neck, shoulders, chest and abdomen, hips, legs and feet, and arms and hands. Checking an injured or ill person who appears to be unresponsive. If a person appears to be unresponsive, shout using the person's name if you know it. If there is no response, tap the person's shoulder, whether it's adult or a child, or the bottom of the foot if it's an infant, and shout again while checking for normal breathing. Check for responsiveness and breathing for no more than 5 to 10 seconds. Gasping is not normal breathing. If the person responds, either by moving, moaning, or opening the eyes, but is still not fully awake, send someone to call 911 and obtain an AED and first aid kit. Proceed with gathering information from bystanders using SAMPLE. Conduct a head-to-toe check. Roll the person onto his or her side into a recovery position if the person does not appear to have any injuries. If the person still does not respond, again send someone to call 911 and obtain an AED and a first aid kit. Ensure that the person is face up on a firm flat surface, and begin CPR, starting with compressions, or use an AED if one is immediately available if trained in these skills. If the person is bleeding, use direct pressure to control external bleeding. Step 1, cover wound on own arm with a sterile gauze pad and apply direct pressure until bleeding stops. If blood soaks through the first gauze pad, put another pad on top and apply additional direct pressure. Do not remove first gauze pad, as this will disturb the clotting process. And also do not place more than one gauze pad on top of the first. If bleeding does not stop with the application of direct pressure, call 911 and monitor the person for signs and symptoms of shock. When bleeding stops, check for circulation, feeling, warmth, color beyond the injury. Apply a bandage by wrapping roller gauze pads in place. Tie or tape the bandage to secure it. Check for circulation beyond the injury. And remove gloves and wash hands. The definition of a tourniquet is a device placed around an arm or leg to constrict blood vessels and stop blood flow to an open wound. A tourniquet may be used when life-threatening bleeding exists and standard first aid procedures fail or are not practical. Life-threatening severe bleeding that cannot be controlled using direct pressure, a physical location that makes it impossible to apply direct pressure and control the bleeding, multiple people with life-threatening injuries who need care, and a scene that is or becomes unsafe. The definition of hemostatic dressing is a dressing treated with a substance that speeds clot formation. Hemostatic dressing is applied at the site of the bleeding, possibly inside of the wound. Hemostatic dressings are used along with direct pressure. Hemostatic dressings should only be used to control life-threatening bleeding when standard first aid procedures either fail or are not practical. Life-threatening bleeding on parts of the body where a tourniquet cannot be applied, such as the neck or torso. Life-threatening bleeding from an open wound on an arm or leg if a tourniquet is ineffective. Common causes of nosebleeds include trauma, for example, when you get hit in the face, exposure to dry or cold air, high blood pressure, and use of certain medications, for example, blood thinners. To care for a nosebleed, have the person sit leaning slightly forward. Do not tilt your head backwards. When that happens, the blood could run down your throat and cause you to feel nauseous. Also have the person pinch the nostrils together until the bleeding stops. If the nosebleed is severe, call 911. Continue to pinch the nostrils together. Alright guys, thanks for sitting through that. That concludes the first aid portion of your first aid and CPR certification renewal. Make sure to complete that quiz within the allotted time. If it is not completed in that time, your certification will not be renewed. I will send out reminders, but just make sure to get that done. Alright, thanks guys.